Hi everyone, I am Hadi Miskin from University of Bisha and University of Jazeera presenting this session about applicability of evidence-based medicine in clinical settings. By the successful completion of these sessions, you are expected to identify and define the concept of EBM, recognize the five steps process in EBM practice, understand the key research method needed to locate medical evidence, distinguish between various levels of evidence and their corresponding clinical study categories, appraise the evidence based on validity, reliability, and applicability, and finally integrate and apply the evidence base within the clinical setting. Healthcare professionals are increasingly required to base clinical decisions on the best available evidence. EBM is a systematic approach to clinical problem solving, which allows integration of the best available research evidence with clinical expertise and patient values. In this session, we will explain the concept of EBM and introduce the 5 steps EBM models, which are the formulation of answerable questions, clinical questions, searching for evidence, critical appraisal, applicability of evidence, and evaluation of the performance. The final steps in EBM process is the application of the evidence found in clinical studies on the individual patients. So once a cause and effect relationship is discovered, can it always be applied to the patients? What is the evidence-based medicines? EBM defined as integration of best research evidence with the clinical expertise and the patient. This integration is very important because the practice of EBM involves a process of lifelong self-directed learning in which caring for patients creates the need for important information about clinical and other healthcare issues. EBM recognizes that the research literature is constantly changing. EBM allows the integration of good quality published evidence with clinical expertise and the opinion and the value of the patient and their families at the same times. Deciding on how to treat patient should not be based solely on the available evidence. Other factors to be considered, such as personal experience, judgment, skills, and more importantly, patient values and preference, must be considered also. The practice of EBM should therefore aim to deliver optimal patient care through the integration of the current best evidence and the patient preference, and should also incorporate expertise in performing clinical history and physical examination. So, the concept of evidence-based medicine is that a systematic approach to medicine in which doctors and other healthcare professionals use the best available scientific evidence from clinical research to help make decisions about the care of individual patients. EBM is the integration of the best research evidence with clinical expertise and patient value. It means that when health professionals make treatment decisions with their patient, they base on it on their clinical expertise, the preference of the patient, and the best available evidence, of course. So, what are the key points of evidence-based medicine? The practice of EBM involves 5 essential steps. First, converting information need into answerable questions. Second, finding the best evidence with which to answer the questions. Third, critically appraise the evidence for its validity and usefulness. Fourth, applying the result of the appraisal into clinical practice, and finally evaluating the performance. This is a flow chart of evidence-based medicines. There is interaction between knowledge, expertise, skills, patient value, and preference, and based on this, we can obtain the best available evidence, and we can take a suitable clinical decision based on that findings. So what is evidence-based medicine? So why evidence-based medicine? Again, the most important reason for practicing EBM is to improve quality of care through the identification and promotion of practice that works, and the eliminations of those that are ineffective or harmful. EBM promote critical thinking. It demands that the effectiveness of clinical interventions, the accuracy and the precision of diagnostic tests, and the power of prognostic markers should be secured and their usefulness to be proven. It requires clinicians to be open-minded and look for and try new methods that are scientifically proven to be effective, and to discard methods shown to be ineffective or harmful. It is important that healthcare professionals develop key EBM skills, including the ability to find, critically appraise, and incorporate sound scientific evidence into their own practice. So there is a certain criteria for application of the result in decreasing orders of the importance. Include the strength of research designs, strength of result, consistency of study, specificity, and to consider confounders as well, and temporality or time-related factors. This is a component of evidence-based medicine, which include the patient value and preference, clinical expertise, and best available evidence. So when applying best available evidence in the clinical situations and consider clinical expertise and patient value, that means we are evidence-based and we can apply the evidence to the particular clinical situations. When we are adjusting studies, we consider validity, applicability, and the importance of the study findings. The stronger the study, the more likely is those results will be borne out in the practice. A well done and well controlled or well organized randomized control trial, which is a large sample size, is the strongest one. Evidence from the efficacy of a practice is defined population. However, these are very expensive and difficult to perform. The physician often must make a vital clinical decision based even on less strained evidence. This is a famous evidence pyramid, which indicates that the most important is a Cochrane systematic review, and then other systematic review and meta-analysis, and then evidence-based guidelines, and so on. And the least one is the clinical reference text. Randomized control trial is very important, and intervention with randomizations trials is very important. When we look for the source population, we consider at risk and not at risk will be excluded, and at risk will be randomly allocated to expose to factors and not exposed to factors. Then we measure the outcome, whether it is poor or good outcome. Example for randomized control trials: ICU patients, we exclude those who are not at risk, and we randomly allocated at risk when arm exposed to the new, for example, antibiotics, and the others exposed to placebo or old antibiotics, which you want to compare it with the new one. And then the outcome to be measured is infection, cure, being to both to arm. So it is very important to assessing the applicability. Is our patient so different from those in the study that result cannot be applied? This to be considered in order to assess the applicability. Is the treatment intervention screening feasible in our clinics? And so what are the potential benefits or harmful from these interventions? Also, what are our patient value and expectation for the outcome we are trying to prevent, and the adverse event we may cause with this treatment, intervention, or settings. So it is very important to talk about the level of evidence. The strongest designs for the evaluation of clinical question is a systematic review of a multiple randomized control trial. This is the strongest and the best. Ideally, the studies in this review will be homogeneous and done with carefully controlled methodology. The randomized control trials with the human subject is the strongest single research design capable of proven causations. The next best level of evidence came from observational study. The strongest observational study research design supporting causation is the cohort study, which can be done with either a prospective or non-concurrent designs. A case control study is a weaker research design that can still support causations. Finally, case report and descriptive studies, including a case series and cross-sectional study, have the lowest. Sorry for this technical issue. Strengths of the research design is very important to be considered. Practical part of these sessions is that we will try to explore some practical part of these sessions, and together we can practice, or alone you can practice in your spare times. The 5 steps EBM. We can repeat it again because it is very important. The practice of EBM involves 5 essential steps. First, converting information need into answerable question. Second, finding the best evidence which answers the question. Third, critically appraise the evidence and its validity and usefulness. And the fourth is applying the result for the appraisal into the clinical practice. And finally, evaluate the performance. So we have here 5 steps. These 5 practical 5 steps, we can discuss it together. Step 1 is formulating answerable questions, clinical questions. One of the difficult steps in practicing EBM may be translation of clinical problem into the answerable question. When we come across a patient with a particular problem, various questions may arise for which we would like to answer. These questions are frequently unstructured and complex and may not be clear in our mind. The practice of EBM should begin with a well-formulated clinical question. This is very important. So good question should be clear, directly focused on the problem at hand, and answerable by searching medical literature. Okay. Good clinical question should have a 4 or sometimes 3 essential components. Number 1, the patient or the problem in question, the intervention, test, exposure of interest, comparison or interventions, if relevant, and the outcome or outcome of interest. Thus, an answerable clinical question should be structured into BICO format. BICO, which is mean B for patient or the problems, I for intervention, and C for the comparison, and O for the outcome, or PU. In this format, patient or the problem for B, and I for the intervention and the outcome for O, and these PU formats. Also used heavily in our settings. To illustrate the concept of BICO or PU, imagine that you have a 4-month-old baby admitted to your ward with a viral bronchiolitis. The child's symptoms get progressively worse, and you wonder whether giving corticosteroids may help the child to improve or reduce the length of hospital stay. Okay, you decide to use clinical scores as a measure of improvement. The key component of your clinical question should be patient also problems, 4-month-old baby with a viral bronchiolitis. Intervention is corticosteroids, comparison no corticosteroid, and the outcome is clinical score and length of hospital stay. A first part of clinical question may be formulated as follows. In a 4-month-old baby with a viral bronchiolitis, Does the administration of corticosteroid compare with not giving corticosteroids improve clinical score and reduce the length of hospital stay? This is your BICO question to be applied for this patient. The step 2 is the finding of evidence. Once you have formulated your clinical question, the next step is to seek relevant evidence that will help you answer the question. There are several sources of information that may help. Traditional source of information such as textbook and journals, and the secondary source, this reliable summarize the evidence which may help you provide quick evidence-based answer to a specific clinical question, included here BGMs, BMG, journals, or clinical evidence.com, or even here beta bets. These are free available source for data for using of EBM. Type. Basic search principles. Here is we have 5 basic search principles. Convert the clinical problem into answerable question. The key successful situation is to convert your clinical problem into clear answerable question, which should ideally be framed in BICO or PO format as we discussed above. Generate appropriate keyword. A word list can be generated based on the keyword from the clinical question. For example, from the clinical question mentioned above, the following keyword could be considered for searching: viral bronchiolitis, patient, this for patient or for the problem, corticosteroid, and synonymous like corticosteroids, glucocorticoids, steroids, prednisolone, and dexamethasone. This is will be the intervention, and the clinical score and hospital stages will be the outcomes. When you have to choose a suitable bibliographic database like Medline. Medline is probably the most widely used database for searching biomedical literature. It is maintained by the National Library of Medicine, US. This version of Medline, which is called PubMed. PubMed is free, available on the internet, and is updated regularly and relatively user friendly. And lastly, we have to conduct this search. Once the keyword and database have been identified, the next thing is to run this regarding step 2. And for example here, example of a basic search strategies to try to find evidence to answer the clinical question I formulated earlier in the previous examples. We can use the keyword generated to search the Cochrane database of systematic review and PubMed using the following search strategy: viral bronchiolitis, corticosteroid or steroid or glucocorticoid or dexamethasone or prednisolone, clinical scores or hospital stay 1 and 2 and 3. All of them can be used for searching strategies. When I found the evidence, we move to the step 3. It is appraisal of the evidence. After you have obtained relevant articles on the subject, the next step is to appraise the evidence for its validity and clinical usefulness. Although there is a wealth of research articles available, the quality of these is variable. Some are good and some are with a moderate to poor quality. Putting unreliable evidence into practice could lead to harm being caused or limited resource being wasted. Several tools for appraisal research articles are available, like the tools developed in which is called Critical Appraisal Skill Programs, CASP, or Export or UK. These include tools for appraising randomized control trial, systematic review, case control study, and cohort study. The CASP tools are simply easy to use and freely available on the internet. We move to the step 4, applying the evidence. When we decide after critical appraisal that a piece of evidence is valid and important, we then have to decide whether that evidence can be applied to our individual patient or population. In deciding this, we have to take into account the patient's own personal value or circumstance. Last steps is evaluating the performance. As we incorporate evidence base into routine clinical practice, we need to evaluate our approach at frequent interval and decide whether we need to improve on any of the 4 steps discussed above. We need to ask whether we are formulating answerable question, finding a good evidence quickly, effectively appraising the evidence, and integrating clinical expertise and patient value with the evidence in a way that lead to the rational acceptable management strategy. Formal auditing of the performance may be needed to show whether the EBM approach is improving patient care or not. After applying these 5 steps in EBM applicability, this is a practical task for you. Choose answerable question, an example of a basic search, formulate strategy for a basic search strategy, and then you can practice it freely based on which she mentioned in this presentation. In conclusion, EBM aims to improve quality of care through the integration of the best research evidence with the clinical expertise and patient and the parent preference. In this session, I have explained the 5 essential steps in practicing EBM, which are formulating answerable clinical question, searching for evidence, making the critical appraisal, assessing the applicability of the evidence, and evaluating the performance, of course. The principles and critical appraisal of randomized control trial, systematic review, and the meta-analysis, and practical demonstration of the 5-step EBM model are based on EBM. You can furtherly return back to this reference for more literature and practicing in this part. Any question, highly welcome. This is my email mentioned below, and thank you for your attention, and thank you for further corresponding, and goodbye.